Apparently, there's no other conversation that should be more important than the one we're about to have now. The reason is simple. Resident doctors, they make up the majority of the doctors in tertiary hospitals. At the end of the day, they have said, we've just had about enough. We can't just sit still, and our members, our colleagues are being kidnapped and some even killed, including their family members. They say no more. So they've taken a case, a particular one that has been, this doctor has been in captivity for about 8 months, and they're using her as some kind of a reference to say, get her out, else we're not going back to work. But we're going to give you 7 days warning strike. After this one, we don't know what they're up to next. But these doctors, we will not speak for them, they'll speak for themselves. That's why we have them in the studio. Joining us from Abuja studio is the President, Association of Resident Doctors, University of Abuja Teaching Hospital, Dr. Abah Innocent. Dr. Innocent, thank you so much for coming on the program.
Thank you so very much for having me. Good morning, Nigerians. Good morning, viewers across the globe. Thank you so very much for having me.
As I did say in my introduction, apparently you said you, the doctors, the resident doctors, which make up a lot of the majority, have said you had enough. So maybe you walk us through how many doctors have been kidnapped in, say, the last 1 year or 2, or as much as you can remember. How many were even killed, or family members, as much as you can remember, and how many were released?
Thank you so very much. Before now, I had sent an archive of doctors that are currently in captivity, those that have been killed, those whose whereabouts we've not been able to establish. I sent that earlier, and as I speak with you right now, we have about 32 of our members currently in captivity. Like I said, some were noted to have died. Some ransoms have been paid, and they've not been reunited with their family. Some are alive, but currently our data shows about 32 of our members that are currently in captivity. Thank you so very much.
And you know, this is a very tricky one. I recall the last time we had this conversation with you and other members. You know, we had security operatives as well, or at least security consultants, who would say, well, maybe some of these attacks are just random, not targeted at medical doctors. But of course, that is quite debatable, really, because he who feels it knows it exactly. So speak to us about the dilemma you had to face, particularly coming off of that emergency meeting which you had Sunday, late on Sunday into Monday. What are the dilemmas you had to face? On the one hand, providing care to people, emergency care, people whose lives are at risk, and then your member whose life is at risk. So how did you go through the dilemma to arrive at the decision to go on strike?
Thank you so very much. Let me start with the notion that was painted by the guests as at the last time we met, when he tried to debunk the idea that doctors are not targeted. Now, it's very laughable, to be very honest and sincere with you. You know, the Nigerian situation, when a challenge comes up, instead of tackling such a challenge, we try to generalize it. And when you generalize situations like this, it becomes difficult for you to be able to tackle the problem. There are very obvious reasons that doctors are being targeted. We've never seen the kind of upsurge in kidnapping of doctors and health workers like we are currently seeing. It's an emerging pandemic. And until government rise up to the task, we'll have a crisis on our hand. And this is the reason why we are beginning to clamor and draw government's attention, because if you have an incident that before now, you're having about 2 cases, say in a month, and suddenly it becomes a weekly occurrence, then something is not right. As I speak to you, again, a doctor was kidnapped in Lokoja. Dr. Fada Hunsi, a consultant radiologist, she was kidnapped on Friday last week, and this is beginning to look like a weekly occurrence. 2 in a week, 3 in a week. And so this is why we are beginning to draw government's attention. So it is not acceptable for somebody to come and say there is no targeted attempt. That is a general problem. We understand that kidnapping is a general problem, but what we are seeing, recent evidence shows a target on doctors. Now, how did we arrive at the decision for the current industrial action? 8 months now we are counting for Dr. Ganiat Pupuola. We didn't just wake up to declare the industrial action. First month, second month, the third month, the fourth month. I mean, this is a Nigerian that was kidnapped right in the hospital facility. And we are calling on government to live up to its responsibility of providing security for lives and property. So this is just the clamor. So it's been there, the conversation has been there, we've engaged relevant authorities. It was because we did not see any palpable effort. That is why we're pushed to the wall. You cannot beat a child and say the child should not cry. Again, we also, the statistics that I sent earlier, we also have Professor Ekanem Phillips, 1 year in captivity. Again, she was kidnapped right in her facility in Calabar. She is a professor of stroke medicine. We do not have as many of these specialists in Nigeria currently, you know, and instead of these people to stay within the hospital facility and render essential healthcare services to patients, they are being held across different kidnap camps in Nigeria. So all we are asking for is we are drawing government's attention to this emerging pandemic, that if it is not tackled, it will metamorphose into a very big situation, because currently the health sector is in crisis in Nigeria. Let me give you an instance where we say the health sector is in crisis in Nigeria and government needs to give dedicated attention to this anomaly. The WHO recommendation for doctor to patient ratio is at 1:6. The Nigerian Medical Association president, Professor Bala Audu, made us understand that this has fallen below 1,000%. As currently we are having 4 doctors to 10,000 patients. And then of these 4 doctors to 10,000 patients, you have a whopping number of 32 that are known to us to be in captivity. 32 doctors who should be able to mount at least 7 teaching hospitals comfortably, should be able to provide comprehensive health care to patients in rural facilities, in the primary healthcare sector, in the secondary health sector, but all of these, our colleagues, are being held in different captivity camps. This is why we're beginning to, rise up to the fact that we need to draw government's attention, we need to engage relevant authorities before this gets out of hand, if at all it has not gotten out of hand.
Let's talk about a few, because you had mentioned something that I had to take up that debate with the Honorable Minister for State for Health, Dr. Tunji Alausa. He had mentioned that the healthcare sector is not in crisis, and we wanted to know what parameters by which he measured that. But now you are the practitioner, the professional, you're saying this as well. But my question will be, how much do you think this strike action or Downing O'Toole's were achieved? Because if it was things like, remuneration or something that relates to welfare that has to do with pay package, even with that is always a big fight between governments and, associations and unions. Sometimes it doesn't happen, sometimes they're even surcharged or their salaries withheld. If after 7 days nothing comes out of this, what happens? And have the authorities been talking to you since these 2 days you've embarked on this strike?
Thank you so very much. Again, the reason for the strike has been well clarified. It was because this is like the only available option for us as it stands, because 8 months. If anything happens to this, our colleague would not be able to, clear our consciences, because conscience, they say, is an open wound, and only the truth heals it. And so this is the time. We know the strike action, we orchestrate some difficulties to Nigerian. It is really highly regrettable. But, as it was said earlier in the studio, if it is good for one, it's good for all of us. So this clamor is also to draw government's attention to insecurity in the country. So, for now, the strike is ongoing. Today is second day into the strike. We are open to engagement, to discussion, to roundtable discussion with government and relevant agencies. All we are saying is the safe release of our colleague, Dr. Ganiat Pupola. What will happen at the expiration of the 1-week ultimatum is left to the National Executive Council of the Nigerian Association of Resident Doctors. The Congress we had Sunday night was only adjourned for a recess. We continue to monitor the situation. We continue to engage government. And if anything positive comes out, we are willing and ready to reconsider our position. But what will happen if she is not released, we may not be able to say until the National Executive Council meets again. Thank you, sir.
All right. I asked earlier about the dilemma because this has thrown up a big debate now. And some are even saying, okay, if all the other professional bodies or unions decide to go on strike as a result of either one of them or more who's been kidnapped, either recently or remains in captivity, they wonder who then will be left to work, even though there's, well, we'll still wait to see, at least see other bodies if they will come out or otherwise. So there's that debate about whether or not this is part of the engagement of labor. Is this enough reason for doctors to go on strike? Again, you can respond to that debate from where you see it. But I'm quite curious to know the options available to doctors now in the coming days. But you can speak to that part of the debate, the propriety of the whole resident doctors in Nigeria going on strike as a result of one of them who's been kidnapped. Again, you feel it, you know it better. They say that what if other unions, other professional bodies go on strike? Is that something that you think you will have set a precedence for? So you can respond to those issues.
Again, thank you very much for that. It may interest you that there is provision for industrial action in the labor law. However, as it was earlier deposited, it was not the primary decision. This has been 8 months. Again, to draw our attention to the fact that, you see, for the fact that Nigerians are beginning to accept anomalies, there are things that obviously shouldn't happen. And I don't know whether complacency of government, because you see 10 people being kidnapped, and then we see it as normal, life goes on, 15 persons being kidnapped, we see it as normal. We are beginning to accept a lot of these anomalies. We should not be. So for the fact that it happened and nobody took action, and everybody went about it and saw it as normal, does not mean if it happens in another sector and people rise up to act, that government lives up to its responsibility of security of lives and property, it does not make it anomaly. So it's our right to demand for security in our workplaces, because again, our colleague was kidnapped right in her place of work. So there's justification for our action, and again, this is a warning strike. So we are hoping that within this period, government will live up to its responsibility and do the needful.
All right, doctor, so let's assume that government calls you to the table. What are the things you would like to hear that can make you call off this strike as soon as possible?
Thank you very much. Our demand is the safe release of our colleague, Dr. Ganiat Pupola. And we are, like I said, we are ready to, it may not be a one-day effort. And this is why we have decided to embark on this, to draw government's attention, because we know with sincere commitment of government, our colleague will be released. So if we are beginning to see this effort, it will be very obvious. Take, for instance, the case of the kidnapping of the 20 medical students recently. You know, it took government a very short time, and the 20 medical students were released. We had this conversation on this platform where we drew government's attention. Along the line, helicopters were mobilized, drones were mobilized, personnel were mobilized, and we saw this effort. Again, we must appreciate the Inspector General of Police for rising up. These are the measures that we are clamoring for. That effort be immediate, response be proactive, because the longer you wait, the more complicated the discussion becomes. Because for Dr. Ganiat, we are talking about 8 months. And so, this is about time government do the needful.
All right. You know, it's just a very sad development, really, that this has lingered for 8 months. One only imagines what the family has been going through. 8 months. This is not 1 week. This is not 2 weeks. This is 8 definitely not good months for the family. So it's a harrowing experience, definitely. Now the challenge will be what will then happen to those who are seeking care at the hospitals? You said there is even no emergency care. Resident doctors are withdrawing service, and we know how vital you are to an already ailing sector, which is ironic because you're meant to provide health, but we know what is happening in that sector. So are you worried that this might then cause perhaps deaths or people not getting access to medical care, so making a bad situation worse? How are you balancing that dilemma, which I started with in the first place?
Thank you. Again, if government has done the needful, there wouldn't be need for this industrial action. Like you said earlier, you said not 1 week, not 1 month, not 2 months. You know, so one has to do what one has to do. We know there are implications to this decision. Again, this is why it's a warning strike for 1 week. If government does the needful, we'll be back to work. Because the other option is for us to forget about our colleague. And posterity will not be fair to us. That we had the voice, the platform, to be able to call on government's attention, and we did nothing. So we want to appeal to the Nigerians all across to also understand the plight of the Nigerian doctor. We are going through so much. As a patient, you want to see a doctor, you know, that is psychologically sound. You want to see your doctor in a good state of health of mind and body. This is the doctor that every patient wants to see. And so if we sit in the consulting room, this could have happened to anybody, knowing fully well that our colleague, Dr. Ganiat Pupola, and all of our other colleagues are languishing in different captivity camps, then posterity will not be fair to us. So we want to appeal to Nigerians to also add voice to our clamoring, to our advocacy, so that government can do the needful. Again, if government does the needful, we will be back to our duty point.
All right.
Please, for sake of clarity, we did not just take this decision on impulse. We've consulted. We've tried to assess the intervention offered over the last 8 months. And so this is the point where we had to take this decision. And we are hoping that since it's a warning strike, government will do the needful.
All right, Dr. Innocent, I want to put up a bit of a slide of the things that the doctors, I should say. So those are the doctors. So if we can get back to the very first one, these are the compilations that were done by the medical doctors. But Dr. Innocent has said about 32 in captivity. So from the list you've seen, some that have been released, some in captivity, I guess, some killed, I guess. So Dr. Innocent may reconfirm in case I'm mistaking one for the other. So if we go to the next slide, we'll see where Dr. Populak's name comes in, somewhere around part of the slide. So number 14 is where you see Dr. Ganiat Popula, which she's been in captivity since December 2023. And this is why they are saying, look, this is just about enough. But let me come back to you, Dr. Innocent, as we need to wind down on this one. My question will be looking at what you said by your own admission that, look, this is becoming too much of a trend. As an association level, at personal level, what measures are you guys taking to protect yourself against all of this? Are you doing any courses on personal safety? At least if government is not protecting you, you don't want to be kidnapped.
Thank you so very much. Yes, we have done a lot within ourselves, among ourselves, a lot of advocacy, a lot of campaign, measures. We have also engaged security personnel in seminars, workshops, because these will not come to an end soon. Although it is our prayer that government will rise up to its responsibility of security of lives and property. Now, some of the measures we have also taken, we've cautioned our colleagues. There is a policy document on, ways to avoid being kidnapped. But again, the situation has gone beyond that because we are beginning to notice this kidnapping right in the head facility. If you will project slide 10 downward, I will be able to talk about some of the slides. So it's not as if doctors are kidnapped on the walkway, on the highway, right inside of the facility. Professor Ekanem was kidnapped right inside of our clinic at Calabar. Dr. Ganiat was, yes. Dr. Chinelo, number 10, Dr. Chinelo Megafu, 28th of March, was among the trained victim, and you will recall that she had tested, that she was a medical doctor, and this was the situation. It was all over the social media. And again, because of the generalization, that makes us not to take proactive measure, when she spoke and sent that tweet, again, because she was on official duty, in that train on transit. Then you see Professor Ekanem Phillips on number 12. This list is by no means comprehensive because there was a kidnap of a doctor in Enugu. It's not captured in this list. There was a kidnap of a doctor in Anambra State. It's not captured in that list. There is a current kidnap of a doctor, Dr. Fadahunsi, a consultant radiologist, in her clinic in Lokoja, is not captured in that list. So that list is by no means comprehensive, but these are our colleagues that are currently in detention. And this has reduced the workforce currently in the health sector. Because if these doctors and personnel are currently in all of their duty posts, it will reduce the current pressure in the health sector. So our members have been cautioned, and some of these measures, time may not permit me to begin to list all of the measures that we've taken, but we've engaged security personnel, we've gotten a lot of professional advice, and all of our members. But the issue goes beyond kidnap on the highway and all of that. We are seeing this is a targeted kidnap right inside
doctor.
of the head facility. You see all of this. And even when they are kidnapped, it takes a very long time before they are released. That is to tell you that, yes.
My apologies because of time, but I think your points are well noted, and I hope, and we all hope, that the government and the authorities will do the needful to not just, secure the release of doctors as well as other Nigerian citizens, but we empathize with your association, and we hope that this will be sorted out so that this strike will be called off as soon as possible. Dr. Abah Innocent is the chairman of the Association of Resident Doctors, University of Abuja Teaching Hospital in Abuja. Thank you, sir, for coming on the program.
Thank you very much for having me.
When we come back after the break, we will switch gears. So the issues that has to do with youths, especially in Lagos State, the Commissioner for Youths will be joining us right here in our Lagos studios. Join us again.